We are a nation with a lot to say, a nation with strong views, a nation that wants to be heard. Now you can have your say. After all, it's topical. We are live from Auckland Park in Johannesburg, and you're ready to interact with you on issues that matter. Tonight, we are talking about health, and we are talking about immigration. Why, you ask? Because it's topical. A very good evening to you, South African, those watching around the world. My name is Blaine Herman, and this is It's Topical. Our sign language interpreter tonight is Triforce Ntsulengwe. Thank you very much indeed for joining us. Control, our digital audience, please. Good to have you on the program as always. Looking forward to interacting with them tonight. And just a reminder to our digital audience to raise your virtual hand if you have a question or comment, and I'll bring you straight into the conversation. Now, you've probably seen that viral video by now. Limpopo's health MEC, Dr. Phophi Ramathuba, speaking about the province's overburdened healthcare system to a patient. The MEC told us that she stands by the content of that video, and then she went on to explain the context, which I will highlight during my conversation with our guests in a short while. But if you missed that video, here's a shortened version of it.
You speak Shona, and then how do you find yourself in Villa when you are supposed to be with Munangago there? You know he doesn't give me money to operate you guys. And I'm operating with my limited budget.
Thank you so much.
Well, you can't appreciate that. You're killing my health system. You are killing my health system.
All right, which leads us to our question of the week. And we're asking you, what do you make of the comments by the Limpopo Health MEC on illegal foreign nationals and their impact on South Africa's healthcare system? Walk with me while we get ready for the roundup. Remind you about where we are in terms of social media at It's Topical SABC. Please, you can also give us a call, 011-714-5958. We would love to take your calls on this program. It's all about your views, interactions with you. How do we get to a better place? That's what the show is all about. Now, time for your roundup. All right, we start the roundup by looking at what's been trending on social media today and the Comrades Marathon. It's all about the Comrades Marathon from 5 o'clock this morning, if I'm not mistaken. As you can see, it's all about that important race. Now, South African Tete Dijana won the 95th Comrades Marathon's men's race in only his second appearance earlier today, and that's why it's trending. The Russian Alexandra Morozova secured first place in the women's race. Here's some of the highlights.
It means a lot because I've been through a lot because before my training camp, something happened. Then I had to go to the psychologist, and then I went to the camp for 3 months, and I took unpaid leave. Yeah, because it also belongs to Mafikeng.
All right, the 95th Comrades Marathon also delivered some wild celebrations and ecstasy for the winners, while there was some sadness and heartache for those who failed to meet the cutoff time. Oh, that gun. They missed out on medals as well after, 12 hours or so? It was even more painful to watch those who missed that deadline by just that whisker. This is what happened when that gun went off. Take a look.
It is going to come to an end. The gun is gone, and these are the desperately, desperately disappointed runners. So disappointed. 89.8559 meters, and the gun cuts you off. You do not get the medal, and there are streams and streams of runners coming in onto the field.
You know, I think that's what makes this one of the greatest races in the world, the joy and the heartbreak. Such is life, isn't it? All right, now back to the topic of the night. It's about South Africa's overstretched hospitals. You know by now that this program always gives you a voice as we reflect on the big stories of the week. So tonight's Word on the Street feature comes from the streets of Coronationville, a stone throw away from a mother and child hospital, Ramathuba, in Johannesburg. This is what you had to say.
What do you make of the comments by Limpopo Health MEC that Zimbabwean nationals are overstretching the SA health budget? Right now here there's 70% of foreigners at the moment that is pregnant. We might not know whether they're legally here or illegally, but the fact remains is that our South Africans is 30% and the majority of foreigners is 70%. So you can't seclude Zimbabweans or Congolese or Malawians. It is a national foreign influx.
Mewa health wa Limpopo. But wamdim gore musole gona ke yeo yona ga se nnete. Ga ra tshwanela go mosola. Ge motho a rwele bothata, o rwele bothata. Bjalo ga re mo supporteng. Nthe a e boletšego se šalang o boletše se e leng nnete nnete yona ya hlaba le kgale re a tseba gore ga re ya dipetlele di thara di khupetše ke a leboga batswadi.
You see, of course, government of South Africa, you talk to only foreigners are too much in the hospital. But of course, all of us have is Africa. You must love each and other.
Rikotendo ndikhala zizaborine nabo sister baborine mara ala bakodangeno legally it's fine and then babadele nazo rikho ba supporta khazo ngori rine ba fana uri bosogola.
I've been born and bred in this area, and things have dramatically changed, especially by our hospital where healthcare is concerned. I've got nothing against foreigners, but what upsets me is that foreigners come here illegally. They expect to get healthcare, and they are the majority of the patients that do come to Ramathuba Hospital. Most of the foreigners comes to this country illegally. Come here legally. Come here and visit and then go back to your place. Don't just come here and stay and want to stay here and want to give birth to your child so your child can have a South African birth certificate. The issue is they are crowding this place and something has to be done.
Phophi, he was right to say that about foreigners, but he was using the wrong platform because it's a political statement. So like I would say, no one chooses to be born in Zim or to born in Botswana or Swaziland. So those comments, they were not right because it was right inside the hospital. It fueled the hatred among the people who live in South Africa.
News is only useful in the context of humanity. Humanity on your screens right now. Let's get you some context. I want to get you some quick facts with regards to medical aid schemes as well, and the public health sector. Now, according to, let me just get this up for you. According to the statistics, South Africa, the country's population is estimated to be around 60.6 million. Now, as of August 2021, more than 80 medical schemes were recorded in South Africa and over 8 million people registered as beneficiaries. Now, a general household survey indicates that the majority of South Africa's population relies on public health care, stating that only 17 per 100,000 South Africans have medical aid insurance, meaning it's about 80% access to healthcare through the public health sector. I want to talk to you more with regards to a provincial breakdown of the number of medical aid schemes in each province. And as you can see, Gauteng leads with around 39%, and then the Northern Cape with only 2%. Now, you'll remember that what was said on that clip by the Limpopo Health MEC, if we listen to it a bit further on, Dr. Ramathuba, said that Statistics South Africa told her that in Limpopo has about 5.7 million people, and 91% of the people don't have medical aid, and they depend on the state. We're going to discuss that further. Let's take a look at this now. A quick glance at the birth rate. And according to the World Population Review, South Africa's birth rate is just over 19.995 births per 1,000 people, while the death rate stands at 9.3 per 1,000 people. What does this all mean? Well, it means that the birth rate is more than double the country's death rate. Interesting indeed. And finally, the national health budget delivered by the Minister of Health, Dr. Joe Phaahla, in May this year, in fact. 64.5 billion rand is the budget allocation for the National Department of Health. 55 billion rand of that, accounting for about 86%, is meant for provinces as conditional grants. What am I talking about here? Conditional grants is to support the HIV and AIDS, TB and STI programs, also human resources, and also significant portion allocated to infrastructure support. So context there, important. What does this all mean for the citizens? Let's discuss and bring in our digital audience. Stay here as well. We also have a number of guests on the program. Dr. Sibongiseni Dlomo is the Deputy Health Minister. He joins us. Kennedy Mandaza is the ZANU-PF spokesperson in South Africa, and we'll be soon be joined by Nelson Chamisa, Zimbabwean politician and president for the Citizens Coalition for Change. Ladies and gentlemen, thank you very much indeed for your time. I just want to start off with some quick views before we get to our guests from our digital audience regarding the comments by the Limpopo Health MEC. Nicolette, what do you reckon? Was she on the right track in terms of her comments to that patient?
Thank you very much. I think that in terms of human rights, the MEC actually erred in speaking to the patient in that way at that particular time. Her views in terms of the amount of money that is being used on foreigners in the hospitals might be correct, but that was not the platform in which to air her views. As an MEC and as a doctor, her first priority is to her patient. And in that moment, she was clearly not taking care of her patient. Not only was she airing a political view, she was also expecting a patient who was ill at that point in time to actually answer her. And I don't think the patient was the right person as well to be addressing her issues to. There are other platforms within which to address her issues with regards to the influx of Zimbabweans and the state of the healthcare. But it wasn't supposed to be to the patient. So in my opinion, I believe, an apology is actually due. And I think I read that she did apologize to the patient for what she did, because what she did was wrong. Thank you.
Percy, then we'll go to John. Percy, do you think the MEC should apologize, or does she have a firm ground to stand on in terms of the content of that video?
Good evening, Blaine. I think that if we took this a little bit further, I think that South Africans are being forced to take a populist view that if they knew the background to this, they would not support at all. And most South Africans would probably turn around and say both the MEC and the ruling party should apologize to South African citizens. Here's why. One, according to the African Charter, which is Article 47 and 49, the ruling party was under obligation to report human rights abuses and failures in Zimbabwe. Number two, Zimbabwe and the ZANU-PF have failed according to Article 16 of the African Charter. So when we have failed in terms of our immigration policy and our foreign policy, we are now turning to target the small individual and not dealing with the political heads and the political elite. Here's the biggest problem, and here's the background that South Africans need to see the situation under. The last thing, Blaine, is that this is a typical example of patient abuse that, if we are honest, actually happens to the poor all the time. It just happens to be directed at a foreign national at the stage, but this impunity of speaking whichever way you can to the poor is an ongoing crisis in our country, and somebody who is a medical professional first and a political head second should be held accountable. Thank you.
Percy, thank you very much indeed. John, to you before I get to my guest.
Thank you very much. Actually, I'm in support of our MEC Phophi, with her sentiments. You know, when Dr. Ramathuba was leading that department, he used to talk about these things, and people didn't want to listen to him. So what the MEC said, it is actually what a normal person on the ground, foreign national, local South Africans, or even citizens here, they need to hear that. We need to know that I cannot leave right now and go to another country illegally. You see, the problem also is the matter of illegality, because when a budget is set, we've got State SA that assists the National Treasury to can set the budget of this country. So people should know that you cannot come here illegally. When did the person come into this country? Because also, the MEC actually should have effected a citizen's arrest if she didn't have an element of humanity in her. Because of that is violation of our immigration act. We've got immigration policy in this country. Right. People should come in this country legally, so not illegally, and they must pay for the services. If they don't have money, an arrangement could be made, because people cannot be denied a right to medical service, but they must be legal. We mustn't be forced and coerced as South Africans. Right. Why are they not doing it to Botswana? Botswana is just across them also. Why are they not doing it in Botswana, in Zambia, all the SADC countries? We cannot be a bedroom as South Africa for all these countries. We can't.
John, thank you very much indeed for your points. Zviko, I'll get to you. I just want to bring in our guest, Percy, as well. I see your hands up. But if you have valid, or if you have an important question to our guest, raise your hands. I'll try to come to you as soon as I can. We're also joined by Dr. Mike Masiapato from the Home Affairs Department. So a well-rounded conversation we're going to have as well. Dr. Dlomo, to you, first of all, the MEC was saying that the country's overburdened healthcare system is now on its knees. Do you agree with the comments made by the MEC of Health in Limpopo, sir?
Good evening, Mr. Blen, and good evening to all your participants and panelists and to the viewers. I accepted your invitation to this program, but did not agree with your approach to this way you are handling it. I'll tell you why. I have been on SABC TV many times this week on this topic. Now, I wouldn't know whether you'd want me to give you a different way the way I've given you. Let me then start by saying discussions started at the time I was the MEC for Health. At that time, in KZN, and Dr. Ramathuba was the MEC for Health in Limpopo under the leadership of Dr. Motsoaledi. Now, there was a realization as we were discussing this matter then that this is just more than just one department that must tackle these issues. I mean, issues of foreign nationals accessing social services in a particular country, including South Africa, has been an issue. Therefore, it is a very clear issue that this must be handled at another level. I mean, recently we have had an issue of should we or should we not accept truck drivers from another country? So it's a big issue that is there. So there are continuous, Mr. Blen, bilaterals and multilateral discussions that are going on this matter. It will therefore limit me to go the way you want me to go in this topic. As I have said in the previous platforms in the SABC TV this week, that there is a policy framework that we are working on this matter, and we will have to actually come up on that. It will be coming in from various departments, not just one department.
No, important point. Important point. Important point indeed, Dr. Dlomo. The point of this program, by bringing the digital audience, the people on the ground, we bring them to you and let them ask questions to the role players and the stakeholders in this country and outside, also with Mr. Mandaza here and Mr. Chamisa coming in onto the program to get answers. That's what it's all about. So the people can ask those in leadership, what is the situation? What is the state of play? Let's dig it a little deeper with regards to Section 27 of the South African Constitution, saying that, Dr. Dlomo, no one may be refused emergency treatment. This goes for everybody. Let's talk about the meaning of what is emergency treatment, first of all. And could it mean that once an emergency surgery, for instance, is performed, a follow-up is also regarded as an emergency treatment? Help us understand that.
Let me tell you what is not an emergency service, emergency medical service that some of our hospitals have been offering to some other people from all over the country. A hip replacement is not an emergency surgery, it's not. Transfusing someone who actually does not have enough blood in his or her blood system from a neighboring country, walking across knowing that treating someone with advanced cancer is not an emergency. Emergency is when you are, in fact, if you go to other countries, advanced democracies, when you work in there, they'll say, Mr. Herman, you are here to our country for 5 days, show us an insurance, medical insurance that will take care of you in case whatever thing happens. So medical, we should not deny. In fact, that is actually in our country tabulated as being, including in our national health insurance, a primary health care service. If you have a headache, a stomachache, this evening you have just arrived, we should offer you that and support you on that. But if you then find that you walk across our country and you need to be operated on to deliver a baby, and that becomes, it's not an emergency, it's a planned arrangement to say, I shall deliver my baby on that part of the country, on that part of the world. That is excluding. So I've just given you what is not an emergency, which is those things that are happening sometimes in other parts of the country.
I'll touch a bit more on elective treatments, healthcare services in a short while, but let me bring in Dr. Masia Pato from Home Affairs. Dr. Dlomo spoke about a multi-pronged approach with regards to how to deal with this issue. So when someone goes to a hospital like what we saw on that video and realize that that patient is illegally in this country, what then kicks in? Is there synergy between health, home affairs, police, for instance, in order to rectify this issue?
Yeah, no, thanks, Blaine, and thanks for the opportunity and for the listeners. Maybe let's start by saying, Blaine, that as the Border Management Authority, we are, hard at work, and the intention is to make sure that we start doing our work to in a way, avoid this kind of instances. Under normal circumstance, if an individual crosses a border from one country to another without documentation that it is actually required, and in this instance, we talk about passports and things of that nature, that particular person is already, in a way, illegal in the country. At that particular point of that person being illegal, that person has already subverted the country's immigration laws. Under normal circumstance, that particular person then needs to be arrested, and that person will then have to be deported back to their country of origin.
Right.
And I'm talking here from a principal point of view as part of the broader provisions in terms of international law and all of the issues that are actually governing the movement of persons from one jurisdiction to the other.
So, Doctor,
let's
talk about it in a practical level. So, if, for instance, you realize that that patient, I'm not saying that that patient is undocumented, I'm not sure, but any patient that is found undocumented, do you go as Home Affairs or law enforcement authorities to that hospital and then arrest the person? How does that work? I just need to understand the process and how these various departments are working together in order to put pay to this issue.
Yeah, so Blaine, what I was basically trying to explain, I was trying to start at the beginning and I was coming exactly to your point. So I was saying that if indeed that particular person was illegal in the country, that particular person should not have even reached that stage, because that particular person should have actually been, I would say, intercepted at the point of entry, and that person should have been deported. So that is basically what I'm saying. Now, on the issue of a situation where you have a patient in a hospital lying on the bed, that is then a different issue. Because if we say, for instance, Home Affairs, Immigration Inspectorate in particular, should be then going into hospitals on the beds and try to go pick up people there and all of that, I think that then becomes more complicated. The principle I'm putting on the table is we should not even get to that point if the person is illegal in the country. But if the person is legal in the country, then that is a different issue. And I think that is the issue that Dr. Dlomo has been starting to reflect on. But in terms of the work that we do, hence we now have the Border Management Authority and the border guards, particularly deployed in the areas where people enter the country illegally. The intention is to actually intercept the people who are entering the country illegally and be able to make sure that they come into the country legally. Right. So we are trying to avoid instances of this nature, particularly if the person is illegal in the country. But if the person is legal, then that is a different issue at all play.
Let me bring in Mr. Mandaza into the conversation. Now, we had Dr. Ramathuba on the SABC earlier this week, and she went on to talk about something called Rural Health Matters. It's a project that was started, I think it's in its second year, and they said basically making sure that the poorest of the poor have specialist care. And she mentioned a figure that they operated on over 4,700 people. But she says people who are coming for these operations are not necessarily from the province. And she went on to say that there's been abuse of this project by illegal foreign nationals. What is your reaction to this, sir?
Good evening, and thank you for the opportunity. Let me start by saying that we may not necessarily give a correct view in terms of the people that were being assisted through this particular program that the doctor who is the MEC referred to. Because it was my first time in my case to hear about that particular program. And I was also even surprised that she made mention of the fact that once programs of this nature that she initiates in the program, in the province, many Zimbabweans get to know about them and they cross the border to seek assistance. What I think could be correct is that those in the Limpopo province staying there as Zimbabweans, once they hear of such a program, they've always tried to make an effort to get to assistance during this particular program. But to say that it is known in Zimbabwe that Dr. Phophi has initiatives of this nature, I think she was trying to stretch the story too far, especially given that for us who stay in South Africa, we haven't heard of that program. And that does not mean that there are no Zimbabweans that could have joined the queue. They could be there.
Let's take it a bit further in terms of what I think Percy was saying in immigration issues. Do you think both countries have failed in terms of protecting the borders? What's your thoughts?
I wouldn't say that both countries have failed. What I can say is that there is a lot of work that has to be done. The fact that we have borders, it means that there are instances where people try to make their chances to get to South Africa. And when that happens using illegal entry points, then there should be police or the Border Management Authority, in this case in South Africa, and also if there are police and other agencies that are supposed to be used, they should effectively control the borders. And I wouldn't say that the two countries or countries in the SADC region are failing to do that, but it is work in progress to make sure that there is control of the people that are moving from one country to another. with regards to the numbers that we have seen coming to Zimbabwe, coming to South Africa from Zimbabwe. I think this has been happening over the years because of the economic meltdown that was in the country. And many people tried to come in, some of them legally, some illegally. And at the end of the day, that is why we ended up having the Zimbabwe special permits to make sure that those who had entered using illegal means, they could then regularize their stay in South Africa.
All right. Mr. If we can just pause, I just need to welcome in new viewers joining the show. A very good evening to you once again and a warm welcome to our SABC2 viewers. It's such a great pleasure having you on board. My name is Blaine Herman. Our sign language interpreter tonight is Trifos Ntsolengwe, and this is It's Topical. It's a program where you have your say on the burning issues of the week, and we have a packed program for you tonight. And as always, our central voice is here on the program, our digital audience. They are joining us from all corners of the world via Zoom with pertinent views on the issues of the week. We also have guests tonight, Dr. Sibongiseni Dlomo, Deputy Health Minister, Kennedy Mandaza, ZANU-PF spokesperson in South Africa. We also have a representative from Home Affairs as well, Dr. Mike, and we will be joined, we understand, by Nelson Chamisa, the Zimbabwean politician, as well as the president of Citizens Coalition for Change. Now, to the issue on hand, our question of the week. What do you make of the comments by Limpopo Health MEC on illegal foreign nationals and their impact on South Africa's healthcare system? Please engage with us. You can tweet us at It's Topical SABC. We'll also look at some of your comments during the course of the program. You can also give us a call on 011-714-5958 or WhatsApp us on 078-459-1819. Now, let's get to our digital audience. Let's bring them back. They had a number of questions to our guests. Let's go, Vico. I know you had your hand up initially. Your question or comment to our guest? If you can unmute us, Vico.
Yes, thank you so much, and greetings to everyone, my fellow panelists and the audience that are viewing this. Right, so me, I rather have a comment about the comments that were made by Dr. Phophi Ramathuba. Definitely, we expect that patients should be treated with dignity everywhere across the world. However, I'm not going to delve into the ethical debate because that one, I think, belongs to South Africans. I'm a Zimbabwean myself, so I will try to talk about something that I think affects us as Zimbabwean first. There was a mention of our president, who is Emmerson Mnangagwa, and also the fact that he is not contributing any budget to South Africa. What I want to say is let's try to look at this issue without involving emotions and be as objective as we can. Look at the facts and see if she was wrong. The first question I would ask is, was she wrong by saying that President Mnangagwa is not contributing to the South African health budget? I think she was very right there, because I don't think the Zimbabwean government is contributing anything to the South African healthcare system. Was she right that the patient was supposed to be treated in Zimbabwe? She was also very right, because the reason why the patient is in South Africa is simply because the healthcare system in Zimbabwe is down. It's a failed healthcare system. Therefore, it cannot take care of its patients anymore. So those facts were actually right, and I think it is the responsibility of the Zimbabwean government to take care of its people. However, I have another dimension as well.
Very briefly,
which is today.
Very briefly, we're running out of time. Go ahead.
Yes. So to our South African counterparts, what I can just say is that please be with the Zimbabweans. They are not there because they want to be there, but because the situation that they are facing in Zimbabwe is very tough. There's no medication in the hospitals. Some of those procedures, they might be elective, but they are not happening in Zimbabwe. Then to our Zimbabwean friends, or I can say try to go legally, the first thing. And also, if you can go and try to register to vote, and vote for a better healthcare system. And I believe this can only happen if there is a change of government in Zimbabwe.
We'll bring in
and
Mr.
under the able leadership of Nelson Chamisa, who will be on
Speaker,
the program.
thank you very much
I think
indeed.
that will be achieved. Thank you.
We're hoping for Mr. Chamisa to come on the program. I'll also take some of your comments to Mr. Mandaza in a short while. Impo, jump in, give us your thoughts with regards to the conversation.
Good evening, Blaine. Good evening to your viewers. Mine is just to ask the gentleman, Mr. Zomo, what format did he expect this to be in? Because I myself am a taxpayer and he should be accountable to me. So I don't know why he's ducking and diving. He must tell me what he's doing there in the Department of Health and not try and hide behind his blue lights or his security guards and whatnot. He's accountable to me, first and foremost. Number two, I think Zviko is absolutely correct. Mnangagwa is doing a very pathetic job in Zimbabwe. But I think people are missing the very important fact that in South Africa, as a taxpayer, what you expect is that you'll walk into a hospital and receive the best healthcare facility and healthcare treatment you'd want as a taxpayer. But we don't get that. And the question that we should ask to Mr. Loma is, what's happening with NHI? You know, we're trying to get a world-class healthcare system looking like a private sector, you know, but it's not. And in Bara, for example, you're not paying doctors. In Bara, you're also not giving patients food. And now we're expected to actually absorb foreign nationals into our healthcare systems. So the bottom line is with the politicians, right? And number two, the politicians are also not imposing a wealth tax on private healthcare system. I mean, you can't have a family owning private healthcare. That's wrong. I mean, you look at Netcare is owned by a family from Stellenbosch. How is that possible? Why is access so limited to people who have? So it's leaving those of us who have not having creating such a demand on a system that has no supply.
Mpo, thank you very much indeed. Let's take it straight to Dr. Dlomo. I'm sure you heard what Mpo Tladi had to say. Dr. Dlomo, your response to his concerns.
His points are not relevant to the discussion that we have. Firstly, I'm here in your platform. I'm not hiding behind my security card, so maybe I should go back to him to explain what does it mean by that. And the issue here is not about the absence or presence of the food in Baragwana. So I don't find his comments relevant to what we are discussing with here now. So I'll probably hold on at that for now.
He mentioned something very interesting with regards to the NHI, and it's there to provide affordable healthcare for all people, despite the socioeconomic status of that person. I want to know with regards to if and when it does kick in full, would it then prevent illegal foreign nationals from getting elective healthcare services? Because now you need this card, you need to produce this card. What sort of mechanisms does it have in order to address some of these issues?
Yeah, no, through international law, we are expected and forced, and it is covered in the NHI, that we will provide primary. First, start by saying South Africans will be provided with a comprehensive health care, and therefore that might be defined later, or what we could define it and what it means. But then it goes on to further to say political asylum seekers, refugees will be provided with emergency medical services, and we discussed that a bit now. So now it means it excludes foreign nationals from the full package that you and me would be receiving through the NHI. And that is what the NHI process now is in Parliament, and if that bill becomes law, it will then kick in steadily, it will be incremental in terms of its impact into the country, hopefully kicking in very much well on the 2026 and then becomes much wider thereafter.
Mr. Mandaza, let's bring you in with regards to Zviko's comments about the state of affairs in Zimbabwe in terms of the healthcare system, saying that there's no medication there. We heard from Tendai Biti, there was a clip that was played there. Control, do we have that clip? If we have, let's just play it and remind Mr. Mandaza what was said in Parliament. This was apparently being discussed in Parliament. Let's play that clip.
public health system in Zimbabwe has collapsed. Yesterday in this August House, we heard from Honorable Mateo that in Chipinge, they are having to take citizens beaten by dogs to Mozambique to get treated of rabies. It's a national crisis. There are no dialysis machines. There are no basic equipment in our hospitals. The Provincial Minister for Health in the Limpopo province, Dr. Phophi Ramathuba, chiding as Zimbabweans that we are treating you. What is wrong with the health system in your country? So we ask, Madam Speaker, Ma'am, that the Minister of Health be summoned in this August House to present a state of the status of our health and how the government is going to deal with this urgent issue.
All right. Mr. Mandaza, is that your experience in terms of what's happening in Zimbabwe?
The issue of the healthcare service in Zimbabwe is something that we have commented on a number of occasions. And it is true that we have been going through challenges with regards to the provision of some of the services that are required, and especially also when it comes to the movement of our doctors and the nurses to seek greener pastures. So we have had challenges, but it may be remiss for us to say that this is what it is as we speak today, because there are concerted efforts to make sure that our hospitals are capacitated. We have all the medication that is required. We also make sure that we have the personnel which is required in the hospitals. But this is a work in progress, because what we have seen in the healthcare system for over a long period of time, more than 10 years, is will also take some years in order to make sure that we go back to where we were before the sanctions regime, which is currently in place at the moment. But it is true that there is need for us to move at a faster pace to make sure that we have a healthcare system that will service the needs and interests of the people of Zimbabwe. But we must also not miss the fact that it is a choice for any citizen of any particular country if he or she can afford the services that he wishes to have, to go and seek it elsewhere. There are many people who are traveling to different countries to seek medical help. And we would also want to expect those of Zimbabwean origin who voluntarily decided to go and seek medical attention in South Africa to pay for those particular services, because it is a choice that they would have made. But at the moment, like I've said, we are seized with capacitating our hospitals so that they can meet the demands of the people of Zimbabwe.
All right, I know my digital audience wants to jump in. I can see Percy eager to get in there. Stand by, I need to take a quick break. This is It's Topical. We're talking with regards to health, we're talking immigration as well. 011-714-595 is the number to dial. Stay with us. All right, welcome back. With the recent debate on the video footage of Limpopo Health MEC Phophi Ramathuba's utterances, it would seem Dr. Ramathuba's sentiments have split public opinion. You heard it here. Let's get more now from our producer, Hlela Mquqo.
Following the outburst by the MEC of Health in Limpopo, Dr. Phophi Ramathuba, on the illegal immigrants who cross the borders to come and access health services in the country is now divided whether she was right or wrong. We speak to some of the health professionals to tell us about the challenges and what needs to be done in this sector.
The system is overwhelmed. Healthcare workers on the ground, nurses in particular, are overworked, are discouraged. They stretch every day. So what actually the MEC of Limpopo was saying, she was actually saying, she said everything that is actually happening in the system.
The Zimbabwean patients are saying coming to South Africa is their best option because the healthcare in their country has collapsed and is unaffordable.
There's no medication in Zimbabwe.
So that's why many people are transferring to another countries to get medication, because in Zimbabwe there's no medication for the patient.
Whenever you get in the hospital, by the time you get in, if they want to use a razor blade, you have to buy. If they want to use the bandages, you have to buy before anything else. If you don't have, that means you are not going to be attended.
Action SA echoes Ramathuba's sentiments.
We agree with the MEC for Health in Limpopo, Dr. Phophi Ramathuba, that this government and this country does not have enough resources to be able to cater for all the people of this continent who come here, and even of the world, and that there's no way this country can carry the burden of so many people. There we agree with them, and there's no problem. The problem we have is that she is addressing the wrong person. It is preposterous for an MEC to be addressing a patient about policy issues that affect the two countries. So the point we're making is that she knows very well who to speak to. She is a leader of the African National Congress, which is the governing party, and they know that the problem is with porous borders that are not taken care of. People are just coming here in the large numbers. If the ANC government does its work in terms of regulating immigration properly, there is no need for the outburst that you have seen from the ANC.
Well, how do you think this issue should be dealt with?
Intergovernmentally. The government of South Africa, firstly, must strengthen its control of the borders. Number two, it must now talk to the other countries who are mismanaging their political systems, causing their people to flock to South Africa. So it's simple. Government must perform, talk to Zimbabwe or Mozambique, and then this matter will be resolved.
The EFF has accused the MEC of violating the constitution, and they say she must be removed.
The constitution of this country is very clear to say anyone and everyone, legally or illegally in this country, deserves human rights and deserves to be treated at any healthcare facility. It's our constitution. That's what we. She took an oath of office based on the same constitution that today she's peeing on. So she must be removed.
Section 27 of the Constitution clearly states that everyone has got a right to access the health services in this country as a basic human right, whether they are here illegally or not. For It's Topical, I'm Hlela Mqhuqho. SABC News, Johannesburg.
Welcome back. You're watching It's Topical. We're talking health. We're talking immigration. Now, we were supposed to have Mr. Nelson Chamisa on this program. We're told that he's still en route to a destination, so it's highly unlikely that we'll have him on the program. But we'll still continue with regards to our guests and digital audience. We have about 6 minutes, digital audience. So keep your questions or comments very sharp and succinct, and we'll try to get to as many as we can. Gugu, you're up first. Your comments, questions to our guests.
Thank you so much for this opportunity. One, we are dealing with a medical delinquent, a doctor who has decided to turn into a medical delinquent. Number two, we have not seen that patient. I want to draw the attention of the MEC to a clinic called Haselepe Clinic. It is at Atok and Lebowa Homo and Genfesi. Those are the hospitals in Limpopo. They don't even have Panado. They don't have any medication there. So the MEC is out of order. I want you, media, to help me and other women locate that woman who has been destroyed, whose dignity has been destroyed by this cruel woman claiming to be a doctor. Number two, foreign nationals are paying taxes in South Africa, and now those taxes are contributing to the hospitals. So now when they go to those hospitals, you don't want them to use their taxes. What exactly is going on in South Africa? And some of those women that you are chasing away are impregnated by South African men. So that needs to be taken into consideration. I've seen and heard South African women saying women from Zimbabwe are taking their men. So these women are actually impregnated by South African men. Three, Migration is as old as humanity, Blaine. Otherwise, we wouldn't be having you here in Africa, Blaine. If it wasn't for migration, we've got migration taking place everywhere and all over. And we are aware as ZANU-PF children of a campaign that is designed to scandalize ZANU-PF and scandalize Zimbabwe. And you are chasing away these potential investors in Zimbabwe. When those potential investors are scared, they will not invest in Zimbabwe because of you, South African media, and Hopewell and the opposition parties in Zimbabwe.
All
We
right.
are aware of that mission and we will not allow it. And I'm here urging the South African media to stop scandalizing Zimbabwe, stop intimidating our investors. Our people need employment, and our people can only get employment if our investors are coming into the country. For as long as South African
Right.
media is intimidating our investors, you need to get ready to have the foreigners coming as many
Google.
as they can in South Africa.
Thank
Number
you very
four,
much.
we've
Thank you
got
very
2
much indeed
million
for your
South
time.
Africans
We're running out
unemployed
of
in
time.
South Africa, according to KZSA.
Let's bring you in, Tumi. Jump in.
I did not interrupt you unless if you called me here.
Sorry, Tumi. Sorry, Gogo. We're running fast out of time. We just have like 2 minutes left, and we still have to get comment from our guests. Tumi, jump in, please, quickly. Just unmute to me. Go on. Oh, sorry, you have to move on. Let's take Ru. Ru, you had your hand up? Go on, Ru.
Thank you very much. Thank you very much. I'm actually very surprised to hear that we're talking international law and immigration law, and the ANC or the government officials, they are not talking about the convention for the status of refugees. That is very clear that there's nothing called an illegal immigrant, especially from countries that people are suffering persecution. Because when people are suffering persecution, they can cross the border. They can cross the border illegally according to that particular convention signed by the South African government. And when they come into the country, they are not supposed to be arrested and they're not supposed to be deported, but instead they should be given papers, they should be given healthcare, and they should be given jobs. Now in Zimbabwe, we've got sanctions. That is persecution of the people of Zimbabwe, acknowledged by the UN. It's a crime against humanity. It's displacing people into South Africa. But the South African government pretends like it doesn't know that Zimbabwe is under sanctions, even though DIRCO in South Africa has actually done a study and a report to talk about the illegality of sanctions. South African banks are instituting sanctions on Zimbabwe illegally.
I hear you with regards to the issues
and
of
then these
sanctions.
people are arrested in South Africa.
All right, let's bring in our guests. We just have about 2 minutes. Dr. Dlomo, your response to some of the comments that you heard with regards to sanctions, and is that part of the issue here on the healthcare system?
You will realize, Mr. Hellman, that you'll have to discuss this matter at another level. Let me just say to you, there are issues that are coming up here. Even in government, I sit on a cabinet cluster that is dealing with social issues, social cluster, and some of the issues that are coming here are cutting across. They even go to issues of security cluster, home affairs, police, and all that. I can't speak openly on those issues because I'm not really able to converse well. But let me say, yes, there may be frustrations on both sides, both Zimbabwe and South Africa, that we are not moving fast enough in terms of our bilateral and multilateral discussions, because on the last speaker, we are very clear that there should be a provision of primary healthcare support to any political asylum seekers and refugees and everybody else. But there is a limit to how much you can go in that. So that's what we need to finalize, comprehensively discuss within the government and have those bilaterals, multilaterals completed in terms of those, so that the frustration that is on both sides should actually be eliminated. Thank you very much.
Dr. Dlomo, thank you very much indeed. Digital audience, value added as always. We'll try to get more of your comments posted on our socials to our other guests as well. Mr. Mandaze and Dr. Mike Maseapato, appreciate your time. Let me give you my take before we leave. On a human level, some in this country sympathize with those who leave their country of birth and desperately seek a better life for their families, their children. It's a natural human instinct to want better, right? However, we are told that the public health care system in this country is struggling in some areas. The health department says there's a high number of undocumented migrants from neighboring countries seeking healthcare services in this country. But numbers are nothing out of context. We need to understand exactly why this is happening. Solutions? More serious high-level engagements between various governments to take care of the locals as well as those who are desperately seeking help in another country. Leaders need to meet. A face-to-face needs to happen. And not just talk. Political will is needed. Plans of action are needed with realistic deadlines, because consequences are in part a function of speed of process. The news continues. Stand by for the Globe. Until next week, my brothers and sisters, take care. Bye-bye.